Hello, everybody. I'm Dr. Sarita Rao, President, Vincas Association, and I have with me Dr. Sujatha Vipperla. She is the chairperson and also the organizing secretary of WCC 2024 conducted at Visakhapatnam, and we are just reaching the conclusion of our amazing academic feast. So, first of all, I would like to congratulate Dr. Sujatha Vipperla on this amazing conference which she has done with didactic cases, live inbox cases, PSS program, abstract presentations, challenging cases, and competitions too. So it has been an amazing 2 days session here with her. And I would like to ask her how she feels that WCC 2024 has it met with her aspirations, her dreams.
Sarita, I'm never happy. So my target was more than 300. So I reached around 220, 230. So, there are more women out there. We try to reach as many as possible. I'm happy with the representation from Karnataka, Andhra Pradesh, and Tamil Nadu. But there has been poor representation from Kerala and East. So we try to improve their enrollment and we try to involve them more in our programs. So this the North has been good. Worst has been Kolkata, that Bengal area. So we have to improve on those counts.
So when all of us started together along with Dr. Jyotsna Maduri, so our aim has been to give women a podium. So women are underrepresented in intervention cardiology in all fields, in all aspects, and predominantly in the intervention side. And when you see podiums, you see less women on them, and many times there is no woman on a podium, and few women get speaking opportunities, and only the very few get chances at live cases. So WINCAS was started as an academic initiative, and it was started as an initiative to promote two things. One is to give opportunities to women cardiologists, and the second is to promote research into women-related heart diseases. Because when we looked at the trials, we found that the maximum representation of women patients in the trial was to a maximum of only about 22%. And we knew that what treatment we are offering women is only the treatment that is offered to men. When women are physiologically, we are different from men, which means that what treatment suits men may not necessarily be the treatment which suits women. And that's why we wanted to do research in that, and we wanted to have our own journal where we published women-related health issues. We did research, we did projects, and Dr. Sujatha has been a tremendous part of the PSS projects. And Dr. Sujatha, what would you say about the PSS projects which came in?
So the PSS presentations are going on, and we also have chosen about 24 papers for the future activities, and we plan to select some projects or the best projects among them and fund them for the Prajwalika scholarship scheme. And Dr. Jyotsna has been extremely active on this front. And also, the most important thing is this WCC, we had 18 papers, and we all of them made an attempt, and Jyotsna was with them, correcting them. And she made the abstract. She sat with them, corrected them, and they published them. And as you've seen, we have released it on the souvenir issue of a supplement issue of WCC with the first issue of IJCWD, where we had published all these abstracts. And also, importantly, all the case submissions which are there, also we have linked them virtually so that whoever has sent the summary, and we have linked the PowerPoints. And the most important thing of this WCC is we are initiating the registers. So this is the most important part for us, to come together, to collaborate, to actively involve in the formation of registries. So we have divided the work equally amongst each other. Like Saritha will be doing the PCI registry, I'll be doing the acute coronary syndrome registry, and this one, Cecily is doing the heart failure registry. So we are going to collaborate with ourselves, distribute the work amongst ourselves, and have data in the WinCars database so that each of us gets to do one study in a way, because this is going to be a lot of work. And Saritha now has got a big task ahead of her to start the ethics committee, our own ethics committee. And now, and also to start these registries is not going to be an easy job, but together we can do more.
Absolutely. I take from Dr. Sujatha's statement that together we can achieve it, and which is why the WinCars organization, it's so important, because there are so many women here supporting each other, standing up for each other, and every day we set a new target for ourselves. And this year the target has been on initiating registries, and yes, each of us have taken on a shoulder of responsibility. Of course, it's my job to coordinate it and to get it started off well. And we do know that it's going to be a challenge and a Herculean task in front of us, but at the end of the day, it's going to be worth it. It's going to be the WinCars data representation, and we are looking to see a lot of sub-analysis and analysis coming out of that, and a lot of helpful data for how we are going to be treating women versus men. So a lot of things are going to come out from that. Yes, it's a Herculean task, but together I think we can do it. And congratulations on an amazing, successful conference at Visakhapatnam. Our numbers are growing year by year. And last year we were at about 180. Today we are at 220 reaching the conference. Interesting thing was that while Visakhapatnam is one of the most beautiful places I've seen, the location of the conference is right by the beach, which was tempting everybody to rush to the beach and not stay in for academics. But it also, we did have face some connectivity issues, and most of us traveled for like about 12 to 18 hours before getting here. So I think that's why maybe representation from East was a little less. But the next year, we are looking at our WinCars Association conference at Delhi, which is very centrally located. And I think we are looking at a very large number of women joining us over there, and the strength of WinCars growing from strength to strength.
Thank you. Thank you, Saritha. It's been a pleasure working with you.